Maybe I'll not go into reduction because my colleagues have already done it, but I need to point out why we thought this was important. Why did we do the study? Is because there is need actually for continuous assessment of the UC implementation process, considering that it is at a pilot stage in Kenya, and that we need actually to generate data and evidence to inform UC guidelines and also the scale-up. So my presentation will actually focus on, I'll highlight on what we thought were the facilitators or the enablers of the UC implementation, and what are the perceived barriers or the gaps. And again, I'll not labor into these methods because my colleague has explained. I'll go straight to my finding, or the finding of the study. And I need to point out that health services in Kenya are devolved, and that each county has a health system. And these health systems are facilitated UC implementation program. We have the Minister of Health. We have the county health management team, which are providing leadership and resource mobilization. We have the infrastructure, and they have the skilled health workforce. And so it was very easy for the county health system to embrace the universal health coverage. But there are still gaps, as my colleagues pointed out. The geographical accessibility to healthcare in hard-to-reach areas was cited as a barrier, especially to the vulnerable and the elderly population. And as you can see, poor road network, and the population still need to hire, maybe pay a lot of money to get to the health facility. And there is also fear among the healthcare providers that the quality of services may be compromised because of the increased workload. There is very high demand for free universal health coverage. And it is explained by the healthcare provider with these quotes. My colleague mentioned that there was community. There is an overall community acceptance was high, and the registration also, there was mass registration. And the community is very happy about it. But again, there was some misconception, as it was said, and this is actually related to the limited information or inadequate information, where people were not actually given enough information to understand the package of UC. And this is at the community level healthcare provider, and also from the community health volunteers who are actually registering people did not actually know what the package or what is being covered under this. Again, the KEMSA, the Kenya Medical Supply Agency, has actually supplied the pilot counties with enough drugs and other medical commodities. And there was consensus, yes, from both the community members, women of reproductive age, and also from the healthcare providers, that they have the commodity. But again, there are gaps also, which may act as barrier. There is lack of basic diagnostic or laboratory services in health facilities, forcing people actually to go to higher levels to access them. And again, also there is fear of stock out because of the influx, more so because of the high utilization of outpatient department. There is stock outs. And where the medicines are not there, again, the community is being subjected to some costs. We all know that access to essential is health commodities, skin deliverable services. So this is an area that needs to be addressed. The political class engagement, again, there was mixed feelings, some saying they were not informed, others feeling they were informed. And this may be a barrier to ownership and resource allocation. And there is need to actually ensure that there is political engagement so that to enhance that element of resource mobilization and ownership. It has been said by the first presenter that actually the community health volunteers played a key role, especially in community sensitization and registration. But however, what is coming from the field is that they need to empower them to provide, in addition to actually registering and sensitizing the community, then they should be empowered to provide health preventive and promotion services. And Also, I will not go into this because it has explained also the USC County USC implementing partners aided the implementation. Some provided logistic support and financial support, and supported by that quote from one of the implementing partners. So, in a nutshell, what we ran is that, the increased outpatient department workload is impacting negatively on the already constrained. We all know that in Africa, the healthcare workforce is already constrained, or it doesn't balance with the population. Healthcare worker is not as it should be. And so there's need to empower, to actually build or to strengthen the health systems. There is also need to protect the economically vulnerable population living distance from the health facilities from indirect costs. This is the cost related to transport to get to the health care or the health centers for care. And access to essential drugs is important to deliver quality services, and this stockout actually will negate the financial protection or benefit of the UC program. And inadequate information also, or sensitization, is a barrier to registration and uptake, as witnessed in some areas, which my colleague has said that there are still some people who are not registered, others are still do not understand what it's all about. And that engagement of community health volunteers, partners, and other stakeholders in the health sector is important if UHC has to succeed. And there is need for a political participation, actually goodwill. More than participation, there should be goodwill and commitment to domestic resources allocation for the UC implementation. So so there is need, and the recommendation is that there is need for the county Minister of Health to explore some innovative strategies to strengthen their own health systems, so that to overcome the existing barriers for UC to succeed. And one of it is actually strengthen the referral system by maybe equip the lower facility levels and decongest the higher level facilities, because that's where people are going, because they're going to higher facilities because they believe that's where they'll get a more comprehensive and one-stop shop where they can get all the services, from better diagnosis, all the medicine, all that. So if they can equip the lower facility level, then they can be able to decongest the higher facility levels and balance the workload. There's only need to expand the health infrastructure and also enhance outreach programs in the hard-to-reach areas. So that they can improve geographical accessibility to health services. As we said, that's a barrier in some hard-to-reach areas. That will enable them to reduce the indirect costs of healthcare and protect the population from financial risk. There's also need to actually look at improve the emergency preparedness of the health facilities. And by that, they will be able to actually raise the community confidence in the lower facility. The community need to know that if I go to facility A, even if it's a lower facility, even if a complication arises, there is enough emergency preparedness to take me to another level. And also, there is also need, in addition to using or utilizing the community health volunteers for registration and community sensitization, we need to strengthen them toward actually empowering or enhancing public health care. And this, we need to build the capacities of the community health volunteers in health prevention and promotion. That will enable the county to reduce the number that is going to the health facilities for care. Because if you empower the community health to do promotive and preventive care, then the risk of the incidence of diseases goes down, and so you reduce that indirectly or subsequently reduces the number that goes to the healthcare to seek for services. And also need to address the CHVs incentives, and so that you can promote or enhance their motivation and commitment to service delivery. And there is also need, the recommendation, that to ensure continuous community and stakeholders engagement in order to create ownership and support for UC sustainability. Okay, thank you. I also wish to acknowledge people who played key role in this study.